Father of surgery. Acharya Shusrut. Acharya Sushruta was an ancient Indian surgeon and physician who lived around the 6th century BCE. He is known as the father of Indian surgery and the father of plastic surgery. His work influenced the field of surgery, especially cosmetic surgery, and continues to shape medical practices today. Here are some of his contributions to the field of surgery. Pioneering operations. Sushruta performed groundbreaking operations such as rhinoplasty, lithotomy, and the removal of a dead fetus. Surgical techniques. He developed practical techniques for dissecting the human body and studying its structure. He also taught 8 fundamental types of surgical procedures using household objects and materials. Sushruta Samhita. This treatise is considered the main source of knowledge about surgery in ancient India. It is also considered the earliest document to provide a detailed account of rhinoplasty. Systematized approach. Sushruta used herbal anesthetics and postoperative care, and emphasized practical experience and dissection of cadavers. Early diagnosis. Sushruta was the first to make an early diagnosis of diabetes by tasting the urine of affected individuals. Concept of vrana. Sushruta described the stages of an ulcer, from unclean to healed, and the management of ulcers. Suturing needles. Sushruta used different types of suturing needles for different purposes. Bandaging. Sushruta used cotton to secure wounds from friction, and recommended changing dressings regularly to protect wounds from infection. The Sushruta Samhita also provides details on toxicology, pediatrics, pharmacology, and other branches of the traditional system of Indian medicine known as Ayurveda. A flower of the golden shower tree, Cassia fistula. The leaves, roots, and bark of this tree are used in Ayurvedic medicine to treat a variety of conditions. Shusrut Acharya, known by many keywords as anatomy, cadaver dissection, cataract surgery, father of surgery, historical vignette, medicine, plastic and reconstructive surgery, rhinoplasty surgery. Sushruta. Sushruta Samhita. Ancient civilizations such as those in India, Greece, Mesopotamia, Egypt, and China have all contributed to the early study of medicine and human anatomy. Among these, the Indian sages, guided by Vedic philosophies and the Ayurvedic tradition, established some of the oldest known medical systems. Indian medicine has predated many other ancient medical traditions by over 4 centuries. Among these early pioneers, Sushruta is often referred to as the father of surgery, being one of the first pioneers in ancient Indian medicine to contribute to such worthwhile findings that have laid the very foundation of modern-day surgical practices. Flourishing inside the historical town of Kashi around 600 BCE. Sushruta's holistic technique to remedy encompassed an extensive range of fields, consisting of surgery, Shalya Tantra, anatomy, beauty and reconstructive surgical treatment, obstetrics and gynecology, ophthalmology, orthopedics, traumatology, and pharmacology. Sushruta's teachings were not a newly created aspect within the existing practices of his era. They further went on to lay a foundation that truly influenced the global scenario of medical science. His seminal work, encapsulated in the ancient Indian text, Sushruta Samhita, reflects his mastery of surgical techniques and human anatomy, marking him as a pioneering figure in the history of medicine. Sushruta's teachings not only revolutionized medical practices in his time but also influenced modern medicine worldwide.